Good afternoon. I'm happy to be invited to speak to you all about my favorite topic, MA, Medicare Advantage, and the growth of it and the future of the program, which I love. And I appreciate Congressman Schwartz, who's an old friend, for inviting me to join you today. So obviously we're about a month out, less than a month out from the election, so who knows what's going to happen in politics and policy. Got Judge Barrett testifying and lots of fun activities on the Hill. But one thing that I am convinced of is that Medicare Advantage and Medicare Managed Care as well, Medicaid Managed Care as well, are both really embedded in the political system now. There's really not that much opposition either with Democrats or Republicans. So do I really think big changes are going to happen? No. 50% of the new beneficiaries turning 65 are choosing MA, and they're doing it for good reason. Their costs are lower, their out-of-pocket costs are lower, and they like the benefits more. So I think there's just been a big change in approach in the last 15 years or so about the political acceptability and support for Medicare Advantage. You know, you look at the biggest states in the country have the most MA. Oregon, Senator Wyden is I hope still a friend of mine, loves MA. Senator Schumer loves MA. So when you look at it used to be 20 years ago perceived to be a Republican supported program, is now pretty much universally has lots of support. And especially as the dual eligible population has gotten more important, and the delivery of service to those folks has gotten more important in some of the inner city and lower income areas, I think there's even been more support for the Democrats in Congress. So really, what I think is going to happen in the next couple of years, I think MA has been growing like a weed. I think it's going to keep growing like a weed. I think there'll be some challenges and some changes. I think there probably will. If there's a Democratic administration, as we talk today, it's pretty hard to figure out who's going to win the election. I mean, Trump is, obviously way down on the popular vote, but when you look at the Electoral College, he's not very far down at all. And having run through that this morning, if you assume that he wins, it doesn't have to be much. He could lose Pennsylvania, win Michigan, and still win the Electoral College, losing the popular vote by 6-7 points. So what's going to happen here, I don't think anybody knows, but I do think one thing you can count on is continued support for MA and continued support for private, well-regulated private health care. And that's really the issue, is well-regulated. What's going to happen? I think if Trump wins, I think you have more of the same. The administration's been very supportive of MA. I think they'll continue to be very supportive of MA. Whether you like them or not, whether you like Trump or not, he's been good for MA, and the administration has been great for the growth of Medicare Advantage. So I think the future with the Trump administration is bright. I also think with the Biden administration, it's pretty bright. I think they like MA. They'd certainly like to have a public option, which I don't think will ever happen out there in the private sector. I think that's, that we went through that with Obamacare, and the co-ops didn't work very well. So I don't think that's really likely to happen. I think they're going to talk about Medicare Advantage or a Medicare buy down to maybe 55 or 50, the age of 50. Also really unlikely to happen in the short run, just because it's really expensive and really, really tough to pull off. So we're going to have a $3.5 trillion budget deficit this year, and if Biden comes in, he's going to have a big budget problem, and expanding entitlements and spending more on Medicare is going to be tough. I think if they do anything, they're likely to do a Medicare Advantage expansion to 55 or 60, which would probably be great for the sector who's involved in this meeting today. But that requires subsidies too. If you're going to go and give people subsidies between 55 and 65 or 60 and 65, they're going to want subsidies like the regular Medicare population. That's also extremely expensive. So, I think things are going to change there, but I don't think it's going to be radical. I think it's going to take a long time. And I think if you get a President Biden, you'll most likely wake up in 4 years having MA be looking in a similar trajectory than it is today. So where's the world going? I think from top to bottom, Democrats and Republicans, people looking at more capitation, more bundling, more risk, less risk for the trust funds, more risk for plans and for other, provider-based groups. I think the real difference you might see in Democratic administration is pressure on MLRs. And what is an MLR? When you talk about well-regulated Medicare Advantage, I think Democrats are going to look a lot tougher as what is your 85% MLR? What's in that? What's the subcap? How much are you subcapping out the docs? What's an appropriate margin? I think there'll be a lot more pressure on that front. And I think that, that may cause a problem for perceived earnings in some of the plans. But I think in the long run, more transparency and more discussion about all that in MA is good. It's going to help the program grow. I think people expect margins bigger than 5 or 6% in MA. The program was designed to have, high volume, reasonably predictable margins. And I think that's where you're going to go. So in the short term, I think a Democratic administration would create a lot more pressure on that, but I think it's going to keep growing. It's very popular. Seniors like it. You look at places like Western Pennsylvania, where I think you've got, almost 60% of people in the MA. Generally a pretty Democratic area. You look at, as I said, Oregon, you look at New York City, these programs are very, very popular. In the longer run, what I think is going to happen, I think the outlook is just great across the board. I do think you get a return at some point. I don't think you're ever going to get Medicare for all single payer. It doesn't work. I think most Democrats who are in this, maybe Bernie Sanders or Elizabeth Warren think it's going to work, but maybe it's actually run Medicare. I think either party knows that's not a viable option. I think you'll get more of a pushback towards federal employee health benefits for all, or we used to call it 25 years ago, managed competition, the Alan Enthoven type approach. We basically have everybody, Medicare, Medicaid, commercial sector, start to look at organized plans. Is that going to be easy to pull off? It's not. It's basically a giant exchange. But I do think from the point of view of where the world's going to go, I think having the commercial sector, the Medicaid sector, the Medicare sector start to change, to share some structure, which is where on a bipartisan basis, people like Ron Wyden and Jim Cooper and even Paul Ryan and people like that 20 years ago are going, we'll probably come back, because the alternative to moving to Medicare for everybody is really Medicare Advantage, or a federal employee health benefits plan for everybody. And even though Kamala Harris proposed that in the primaries, I think not having any idea what she was talking about, most likely, it's really not a bad idea to actually have the system be structured a little better and have the commercial sector, the Medicaid sector, and the Medicare sector share some of the same goals and drive some of the same outcomes. That would probably be great for plans. It would be great for plans. So is that something to be scared about? No. I think the politics of that are really tough. It's going to take a long time. But I think if you're looking 15 years down the road, are you going to move more towards federal employee health benefits for all, or Medicare Advantage for all, which are basically the same concept, or towards single payer and fee-for-service Medicare for all? I think it's much more likely you're going to be looking at an FEHBP for all type outlook. So I think the future is great. I think the future is extremely bright. I think if I look for anything, I'd say more subcapitation and more specialty, like companies like a Nava Health that I was involved in, or a DuPage Medical Group, or any place else that can take cap from plans and drive better outcomes. The goal is going to be to keep people out of hospitals and out of institutions and in lower cost settings. And I think that's just inevitably going to happen. I think things like hospice, where I'm a big fan of hospice, but there's a huge amount of overutilization in hospice. I think of, folding hospice into MA, things like that are just going to drive better outcomes and a much better future for healthcare. So I think that the future for MA, I was very involved in creating MA. It used to be called Medicare Plus Choice. When I was running CMS in 2003, we obviously passed very contentiously Medicare Advantage and Medicare Part D drug benefit. Very proud of that. It's not so contentious anymore. Everybody kind of likes it 20 years later. So I'm glad to see that. But there's a reason people like it. It's been a better deal for seniors. It's been a great success as far as keeping premiums reasonably in control, both in Medicare Advantage and in Part D. And I think that's going to keep continuing. I think the political support for it has grown more and more. I think the concept, whether you're a state capitating out your Medicaid, the health plans, or Medicare capitating out Medicare Advantage, the idea of the government delegating risk and performance to hopefully well-regulated third parties is going to keep growing. So I'm very bullish on the future of Medicare Advantage. I think it's a great program. I think the changes that are going to come are going to be modest, and the growth is going to continue, and that's because seniors like it and seniors support it, and economically it makes a hell of a lot of sense. As far as some of the developments I see coming, more specifically in areas of Medicare Advantage that I expect to come in the next couple of years that I think will help growth. As I mentioned, I was very involved in Nava Health, which is kind of post-acute bundling, where they've carved out, it's now part of United, big pieces of post-acute care. I think they've done a great job of driving down nursing home utilization and other post-acute utilization and saving money across the board for patients and providers. A company I've run across that I think will be another kind of trend in MA is Dispatch Health, which is driving down ER utilization for a lot of plans, including, I'm very involved in the PACE program, which is kind of the ultimate, I guess, capitated dual eligible program, where they're essentially sending out, if you create the right incentives, which is what Dispatch does, you send ER docs or nurses out to a patient's house to avoid them having to come to the ER. And in all of our managed care plans, you can tell seniors go to the ER a lot, frequently unnecessarily. So if you can find a way to create the right incentives to go see these people at home for a quarter of the cost and lower utilization, that's a great benefit. I think the whole managed long-term care in the dual eligible space is growing like a weed. They've done a great job in Massachusetts and Minnesota. That's going to keep growing, creating the incentives for people to manage nursing home care and other long-term care for chronic, long-term, high-cost patients. PACE, as I mentioned, is one of my favorite programs. I'm chairman of a company called Innovaze that's kind of turbocharged MA plus dual eligibles. It's a program of all-inclusive care for the elderly. Incredibly popular program with both Democrats and Republicans. Republicans like it because it's the ultimate capitation. The government, Medicare and Medicaid, pay for a patient for the course of a year, period. They pay for everything. Nursing home care, hospice, everything is in one ultimate bundle, and it's total capitation. Republicans like that. Democrats like it because it's a wonderful program for frail, elderly, sick people, and it's kind of the most comprehensive dual eligible thing out there. So I think that's going to keep growing. Home health capitation is, I think the home health plans for years fought MA because they love the fee-for-service Medicare program. They have great margins. I think they're coming around to that. Humana, who we invested in with Kindred, certainly sees that coming and is trying to find a way to fold home health and hospice into their overall offerings. And I think you're just going to see a lot more specific patient area subcapitation that's going to drive a lot of behavior in the MA. And it's the right way to go. The more our plans focus on getting the right patient bases and focus on creating better care at lower costs and driving better behavior in subpopulations, the better the plans are going to be and the lower the costs are going to be. And I think it's going to be a continuing trend, something that can't happen in fee-for-service. I love the Medicare program, but fee-for-service just doesn't work. It's been shown for a long time to generate massive overutilization, and it's not going to stop. Price fixing doesn't work, never has, never will. Creating incentives for well-regulated, capitalism to provide better services is the right way to go, and that's where we're going to be. So the future of MA is basically just driven by human behavior and great economic incentives, and it's going to keep going. So the only thing I would suggest to this group is it's a great business model. It's a great business. Don't overreach. Don't get greedy. Don't expect 15% margins from government programs because you're not going to get them eventually. It's not going to work. Medicare Advantage is designed to have 85% MLRs, whatever the hell an MLR is. You can measure that in a million different ways. 10% admin and 5% margins at very high volume. And it's a great business, whether you're for-profit or nonprofit. Expecting people to consistently have government programs kick out much higher margins, it's just not viable. And at some point, the transparency is going to keep that from happening. So I would focus on what I think is a wonderful program that's going to keep growing, keep providing great services for seniors. And hopefully with our growing and aging population, keep our costs and our behavior in the healthcare system somewhat in line. But I think it's the only way to go. And I think the MA model is only going to grow and grow and grow across the rest of healthcare. And I think that's a great thing for all of us. But the one thing you can't expect is you can't expect 15% margins because government programs aren't going to pay 15% margins. So I would stay between the lines, behave reasonably, and happily run an ever-growing and larger fabulous Medicare Advantage program. And I think you're going to see lots of other components like duals and others growing off of that and combinations of all the dual programs. And if you're in the Medicare Advantage business, your future is bright. I'm getting to be an old guy, but you're going to have a lot of jobs, a lot of activity for a long time because I don't think the program's going away under Democrats or Republicans. So I'm glad you all are here today and as part of the conference, and proud to be affiliated with Congressman Schwartz, who's a very nice old friend, and a lot of your members who I've dealt with for years. And I think the future of capitated seniors health plans is a very good one. And I think you're going to be talking about making Medicare Advantage great again. That's a little joke for a long time to come, no matter who is president. So thank you for having me. And I hope this adds to your conference a little bit. And I look forward. I wish I was there in person as you all do, but hopefully next year we'll all be in the same room together. Thanks.